Let's look at the future now. Let's look at what's happening today and what's necessary for us as nurse leaders today. As you may know, the Institute of Medicine and the Robert Wood Johnson Foundation sent a report on the future of nursing in October of 2010. These are the things they told us. They said that nurses had to practice to the full extent, not just doing tasks, but to be a leader in changing healthcare and a leader in healthcare reform, functioning as a full partner with our physician colleagues. These are the things that we see happening in those organizations that have an excellent transition program into practice. Those organizations who are really helping nurses become those case managers for congestive heart failure, COPD, pneumonia, and so on. So that we are really, again, looking at the continuum of care from the home into the acute care, ambulatory care, home health, if you will, and back and forth throughout all the care arenas. The triple aim from the Institute of Medicine says that we are going to improve the health of the population. We are going to enhance the patient experience of care, quality access, so actually being able to get care, and reliability of care, patient safety, best practices, and to reduce or at least control the cost of care for each individual. These are the main ideas and concepts, that there would be a focus on the individuals and their families. So patient family-centered care, that we'd have to redesign the way people access care and how our care is structured, that we'll have to manage population health. So what about people with cardiovascular disease? How do we manage that? How do we manage diabetes so that people can maintain their blood sugar levels at a reasonable level and avoid negative outcomes? Also, to be able to control our costs and integrate our system. So what we're really looking at is improving healthcare, because the best quality of healthcare is the most cost effective. We also have the Partnership for Patients. Surely you've heard about this, because Dr. Don Berwick and Kathleen Sebelius, our Secretary of Health, announced this a couple of weeks ago at the American Hospital Association convention, right after they had announced it in the Rose Garden. This is a $1 billion program to reduce patient injuries by 40%, that will save 60,000 lives, and to also reduce hospital readmissions, unnecessary readmissions, by 20% in the next 3 years. We, as nurses, are instrumental in making that happen through better care, better patient safety, and better navigation through the episodes of care. The Washington State Hospital Association has signed up to be a member in the Partnership for Patients. This will save about $35 billion in costs for our national healthcare system. So we've moved now from looking at Florence Nightingale and the beginnings of nursing as a science and an art, and now we're looking at what happened out in the public health care system. And this is one of my favorite nursing leaders, because I worked in public health in Wyoming and also the visiting nurse service in Denver early in my career. So let's figure out who that person might be. And I'm going to let you guess for a minute at home and see if you've figured out who that could be. She was the founder of public health nursing and the Henry Street Settlement in New York City in the tenements in 1893. This is Lillian Wald. She also began the first system of school nursing, and as she worked with the Metropolitan Life Insurance program, she coordinated nursing with that and recommended at that point that everyone be covered with health care insurance nationally. Oh, she was ahead of her time. Just a little story about Lillian Wald, because I think it's an important lesson for us. She was teaching students in the tenements about how to do basic nutrition and hygiene in the home. And as she was teaching that, one of her students came to her and said, you know, my mother is really sick. She's just given birth. And as you remember, back in those days, there was a fair amount of childbirth fever because of the unsanitary conditions and the way that children were delivered. So Lillian said, I will accompany you home to see if I can help you with the situation. And as she actually got into the tenements and saw how people lived, she could not let that stand. And that is how she began her career with public health and development of the Henry Street settlement. Here you see in front of you some pictures of the tenements. It's a little bit hard to see. And again, over here, a public health nurse. I'd like to read you a couple of quotes from Lillian Wald. She said, "Reform can be accomplished only when attitudes are changed." I think of that every day as I hear people complaining or concerned about health care reform and the Patient Protection Act as well. She said, "We commit ourselves to any wrong or degradation or injury when we do not protest against it." We commit ourselves if we do not protest against the degradation or wrong or injury. We must step up to the plate. This nursing leader, Edith Draper, you'll see her quote over a view of a frontier nurse in the Appalachia on a horse. She said this in 1893, because I think this really stands for us today. "The difficulties to be encountered, one must truthfully admit, will be mainly of our own manufacture. What we need is energy, a purpose, enthusiasm, a spirit of philanthropy more developed, and ambition to lift our profession to a height to which the eyes of the nation shall look up and not down. Nothing is more conducive to the ruination of our project than lukewarmness and conservatism, which does not look beyond individual benefits." I think what she's saying here is we have to quit whining. We have to step up. We have to have the energy, the purpose, the enthusiasm, and to really be the leaders that the Institute of Medicine asks us to be, that our clients, our patients ask us to be, because they trust us with their lives. "Nothing is more conducive to the ruination of our project than lukewarmness that does not look beyond individual benefits." We have to look at the benefits to all those that we serve. Okay, so we have a new nursing leader here. This nursing leader, see if you can figure out who that might be before I tell you. She was a political scientist, a suffragist, and a secretary of the International Council of Nurses. This is Lavinia Doctor. Lavinia was one of my favorites also, and she was in the same time span and knew many of the women that began nursing in the United States. She believed that if women could not vote, they could not be able to run their families and heal their families in the way that was necessary to produce the best health in the public. And so she felt that that was very important, and so she did picketing, parading, and protesting. She also wrote one of the first nursing textbooks, and she sold 100,000 copies, which, you know, I would really like to sell that many copies of my books. She said something that I think is important for us as well. We must know how our work of nursing arose, what lines it has followed, and under what direction it has developed best. Possessing this knowledge, each one may help to guide and influence its future on the highest lines and in harmony with our historical mission. So continuing the values that we begun. So let's think about how she was out there protesting, picketing, parading, really loud, out there saying what needed to happen. And then let's look at what we've heard recently from the Silence Kills report in 2006 and the Silent Treatment Study in 2011. We learned in 2006 with the AACN and the Crucial Conversations folks from Vital Smarts that when it came to teamwork, 75% of the people were concerned about it, but only 16% spoke with their peer. And then about incompetence, only 3% of the staff even dealt with it, and only 16% of the supervisors confronted. This does not fit with our ethics. This is not fit with our values and what we have learned is necessary to keep our patients safe. So a lot of work has been done over the last 5 years, and in 2011 the silent treatment just came out, and what they found out is that all the safety tools and the checklists and everything that we've been doing, the bundle of best practices, they have helped us, and also that that 85% of the people that they studied said that a safety tool had alerted them to a potential problem, but only 58% said they did not address the problem because of fear of reprisal or someone being angry with them. 11 to 70% shared their concerns about incompetence, though, which is they were 3 times more likely to share their concerns than before. So we are not there yet. But again, think about the people who are out there getting arrested for women's rights and then not speaking up when it could affect the health and life of our patients.